For being here with us. Just quite recently, the federal government received 846,000 doses of malaria vaccines aimed at reducing malaria mortality by 13% in children who are under 5 years of age. Well, we're going to be discussing the implications of this development, and we have someone in the studio. He's not a new face. He's Dr. Nwodoh. He's a nurse practitioner, and he's also a lecturer with the University of Nigeria, Enugu campus. Good morning, doctor, and thank you for joining us this morning.
Okay. Thank you very much for having me once more.
Definitely. It's always a pleasure to have you sit down here because your insights are top-notch.
Oh, nice hearing that from you. Nice hearing that from you.
All right. Just as I spoke in introduction, what exactly is the implication of having 846,000 doses of malaria vaccine as against the number of children? I don't know the exact numbers now, but I know we have much more of those numbers of children who are less than 5 years, and we have 846,000 doses. Do you think is a step in the right direction? What are your thoughts exactly?
Thank you very much. Well, this is the first time it is happening. And being the first time it is happening, first of all, let's give kudos to who made it possible. For them to have thought it wise to send such quantity of doses to Nigeria is a step in the right direction, and that's a thing that we all have to commend. That's to start with. And coming to the number of doses, whether that will be able to, no, it definitely can't go around to the number of persons that may need it. But one thing with every new vaccine, especially in a setting like ours, is that there may be a kind of skepticism among the parents of the children that will receive these vaccines. Some may still be doubting whether that will do the work or not, whether these people want to experiment with us or not. Some may even come up with myths. Things like they want to stop us from having children, they want to kill our children, they want to, all sorts of things will start coming up. And those are going to affect the number of persons that will be going to receive the thing. So because of that, I so much believe that the quantity released now will go far. It will go far. However, there is much work to be done by healthcare providers in the field to sensitize the populace more on the need to receive these vaccines because they are necessary. Imagine if malaria becomes a thing of the past in Nigeria. In the health sector, it will be a major breakthrough.
But then, I know it's going to be a major breakthrough in the health sector, but do you think some pharmacies and some drug-producing companies would like this thing? Because I know how much they make per year on malaria, especially in the north.
I was coming to that, actually. In short, when I was called for this, I gave a thought to that and asked myself, imagine in Nigeria where there is no longer malaria.
A multi-billion dollar industry.
It is a multi-billion-dollar economy
that
we are trying to stop with this. And when I gave a thought, I said, okay, first of all, starting from the healthcare providers, the nurses, the doctors, and everybody. How many patients would you see without relating malaria to one of the problems the person has? So definitely, you are going to make income from seeing such patients. The drug-producing companies, the pharmaceutical companies, hey, they've been inventing anti-malarials from this to that, to that, to that. What would happen to all of them? Do you mean all of them will just fizzle away like that?
But it's still the big pharmas that produce these vaccines. Yes. So wouldn't it be switching out one just to reintroduce, like some sort of a substitution reaction? Because vaccine is also a multi-billion-dollar economy.
Okay,
right?
Even though vaccine is a multi-billion-dollar economy, you can say that it will be as many pharmaceutical companies as possible that are producing anti-malarials today that will also go there into producing the vaccine. I think there are just like, I know GSK is there, and which I think only GSK that I can remember seeing their names in the among the companies that produce. GSK is just one out of how many millions of companies. So many of them will actually, in short, it's a time for everybody to start thinking of a new way to manage the health sector economy. Because if it actually works, which is our prayer anyway, there will be a serious drift from what the economy used to be like in the health sector. Both the private practitioners, the public, the pharmaceutical companies, and everybody. Imagine all these insecticide treatedness and some other ones. You know.
And all the grants that come with
awareness
of...
But the things will be affected actually. However, you see it is still a good step in the right direction. And if it becomes something that will work very well, we'll be in for it and we'll be well with it.
Okay, so I have this very pressing question. I know you're a medical and health practitioner, and you might not really be into the nitty-gritty of policies, health policies, but you could have an idea. I know we are recipients, and we are grateful. We have already expressed our gratitude. But do we at any point try to research these vaccines? Like you alluded that the malaria vaccine is actually new. Talking about the clinical trials, did they really go through the right, development processes? Okay. Are we sure that these things, do we do our due diligence
somebody
as
trying
a
to
country?
make some billion
the thing is, the healthcare, the orthodox healthcare practice is not where you just do anything anyhow. It's not like where the likes of those people that shout in the park, they are selling this, it will cure everything. It's not like that. I wouldn't like to mention some names, But before you come up with a vaccine that will be used on the populace, there are a series of stages you must pass. Verifiable stages. From the researchers giving a thought to it, to formulating what it will be like, going to get it, carrying out experiments on laboratory animals, and experiment upon experiment and correcting on laboratory animals until it gets to a stage where they feel, yes, this can be safe on human.
Does the Ministry of Health do their due diligence to ensure that these vaccines pass through all the stages?
For the World Health Organization, which is the world #1 body that regulates all this, to sanction that, they have verified it.
Trust them that way?
Yes, that is it. Nigeria is a partner, to everything World Health Organization does. So for them to sanction that, believe you me, is something they have scrutinized and felt, yes, this is something that we can give to humans. Even at the clinical trial stages, they still make some levels of modifications to make sure the benefits one gets from this far outweigh any side effect.
Exactly where I was going to go.
Hold on, Josh, hold on. I hear you.
Yes.
You're not the World Health Organization, neither are you a big pharma. However, we are trusting your insights.
Yes.
We hear that we need to the World Health Organization. But there is this school of thought, which has actually been the driver for vaccine hesitancy and skepticism, that says they are using Africans as test subjects. This is the last stage of their clinical trials, and they need a large number of people, and they think because Africans don't ask questions, they push it down to Africa so that they can now. That is why they always ask you data. These people, they give you something, they ask you, what are they doing with the data? So they are saying that it's possible that we are now the guinea pigs.
Elaborate.
Please respond to this and assuage some of the fears that people have.
Yes, please. Anybody thinking like that has not actually known how these things work very well. Because that World Health Organization is not does not have only people from one part of the world as representatives. People from Africa, including Nigeria, are there. Even for you to even do clinical trial, not only people, the Caucasians, will look at what we are doing. People from Africa, and Africa especially being the part that is affected mostly by this Plasmodium falciparum that causes the malaria of a thing. We will be so much interested in the whole thing. That they are bringing it to us is because this thing affects us more. And the World Health Organization is also thinking of what they can do to help the Nigerian and African populace come out.
Africa.
They love us. So it is because of the love that they are doing this. That is my understanding of it. Anybody holding any other view may not be very close to knowing the realities of how these things work. And that will just be in the realm of imagination, speculation, or myths, please. once it has been pushed out, especially by that world number one body, please, let's not have any fear. Let's receive it.
Okay, so during COVID-19, vaccine came out, and then a lot of people had side effects from it. I mean, pain, redness, headache, muscle pain, chills, fever, and so on. So what side effects should we be expecting from this vaccine?
Just like every other vaccine, you know, this is like trying to give your body an antigen.
No, break it down.
Okay, antigen is like, you know, the body has armies. Inside, armies that are inside.
That
fights any
diseases.
invader.
Yes.
These invaders are usually microorganisms. So these armies are always ready to combat any microorganism. But they are specific. Army A will fight microorganism A. Whereby the body has army A, B, C, D without others, and microorganism S is introduced, it will overwhelm the body. So what is done in this vaccine is that microorganism the body does not have, that army the body does not have before.
Maybe a particular battalion of armies is missing.
The strength of such microorganism will be minimized to a very low level, so that when it is introduced to the body will be sensitized. Something called what we call antigen is that thing that they will give to your body. The microorganism causing a problem, that the potency has been reduced drastically, will be introduced to your body.
Hold on. In this case of this malaria, this is a vaccine 101.
Yes.
In the case of malaria, you mentioned is malaria falciparum that causes...
Okay, Plasmodium falciparum is the one that usually causes the problem.
So you're now saying that this falciparum is the antigen.
Yes, that is the one that usually causes the problem. So what they do in creation of this vaccine or manufacturing of this vaccine is to
get it,
reduce the strength,
the
potency of that thing so drastically, so that when it is introduced to your body, it will sensitize the body to react. And that reaction of the body is the immune system that will react. That immune system now will start building up armies that can fight such microorganism. And when they build such armies, when that small quantity was introduced, the armies will be there in the body permanently. And whenever anything similar to that comes to attack the body, the army that has been made for such will just go there and stop it from attacking the body.
This is the basics of vaccination.
Yeah.
Wow.
That's what is done in vaccination generally. So by the time a new thing like that is introduced to your body, I'm coming to what you asked about the manifestations one may see, especially undesirable ones. You know, when a new thing like that is introduced to the body, definitely the body will react. You may have fever. You may have any manifestation of any foreign thing coming to attack the body. But because the potency has been reduced, the manifestation will not be such that will overwhelm the person. It will just be normal manifestation that will make the body, to build up something with which it will stop this and develop that antibody that will always be there in readiness to combat.
Okay. Something just came to me.
Yeah.
So the resistance that vaccines reduce is once for a lifetime.
That is the essence of giving you.
So what's the need for, there are some vaccinations, even with COVID, they said booster dose.
Yes. All these things are just like when you tell somebody, please do this thing for me. The person will remember that. After engaging in some of the activities for 2 or 3 days or 4 or even a month, the person will tend to forget. You have to now remind the person, please, remember that thing I told you to do, please do it. The person's mind will come closer to remembering it until maybe when the person wants to maybe forget again, you come and tap the individual, please, remember I told you to be doing this thing. By the time you tap to that level where the thing registers permanently in the memory of that individual, it will be difficult for the person to forget it again.
But if
that's the same thing that happens to the immune system.
If the vaccine,
when you give small dose, the immune system is sensitized. Those booster doses you talk of are just trying to tell the immune system, please, you have not done enough, do more.
Well, why are some vaccines, one dose you are done,
and
others you have to give one,
is it because
second,
of the virus coming in? Is it the potency of the virus coming in that makes...
You know, it
like maybe
depends
if you
on...
give it once, it could like elicit like a full-blown disease. So
It
they
all
now
depends
give
on the type of vaccine.
Okay.
Some of them are live attenuated, some of them are potentially
Live
reduced, and
attenuated
many
means
other
what
ones.
is live attenuated?
Okay, maybe that is the microorganism is alive. The one being introduced to your body is alive or has been weakened. Eh?
Yes.
In that case, you will receive live microorganism, which will now sensitize your immune system to react to build the army to combat anything like that in future. And once the army is built and are there in the body, that's all. Whenever anything like that comes your way, they will just go there. Without you knowing about it, these ones will be fighting the war for you.
Our hidden battle.
Yes, hidden battle.
Okay, so let's talk about what's currently going on, about having to have 846,000 vaccines, yes, coming to Nigeria. Of course, you're in the health sector. What challenges do you think we would have in having to distribute this in the country?
Well, as I said earlier, because of those beliefs and disbeliefs around, you can see the way you were asking me questions about acceptability and all those things, and what you may even be feeling. A lot of other persons may be having such feeling, and that may hinder a kind of rush.
Okay.
Especially at this initial phase. So because of that, I believe that if they just distribute it the way they usually do in the entire country, it will still be able to go a long way, in helping our people. However, by the time the people realize the importance, there is need to increase the dose in larger quantities. And that's where government subsidy, it's not only subsidy, but let it be free. The cost is not too much. Government has to come in here. Because if you start doing it out of pocket, then many persons wouldn't. In short, people that have not even eaten well. They're telling them to come and pay for something they are not seeing the immediate benefits. They don't even know what you are talking of.
All right, so what's the criteria, as a follow-up question, what's the criteria for selection? Because we know we have more than 800 and...
we have 200 million people. What are we
living under 5, because they actually...
Okay, it has to be under 5.
The recipients must be under 5 years of age. But we know we have many more children than the number.
It's mainly through
so what's the criteria for
primary
selection?
the primary healthcare agencies. National Primary Healthcare Development Agency is there, the one by the federal government, and also states also have that. Those primary healthcare facilities in the country, that's where they usually send them. Area with higher endemicity. That's the area that usually have such case more will receive more. And those places where the cases are reported are not well reported as the other side, will receive fewer quantity. That's how they usually do the distribution. And that's how they will still follow in doing this one.
All right, do we see... Okay, let me just ask you this question. And if you're not sure, that's all right.
Okay.
At what point, because we know that usually these vaccines are distributed through Gavi.
Okay, yeah. That is the funding agency.
Yes, funding is through Gavi.
Yeah.
Will there come a time when Nigeria will begin to produce her own vaccines for her people?
Like every other pharmaceutical product. Produce. And one thing I like about science is that it's not like a knowledge that is hidden. The process through which you do the production. The process through which you do the production is something that is verifiable. Everybody will see every step through which you did the production, the ingredients, and how you were able to combine this with this to give us this. However, because the company that produces needs to break even for such invention, like 10 years is allowed. It will be patented for like 10 years when the company alone will be the solo producer of that product. And whatever money that comes, the producer will be getting it for at least 10 years.
To be able to...
Yes, before other companies now that have the facility to do the same thing will now borrow the knowledge, experiment, and also come up with that. So because after 10 years, and there are good pharmaceutical companies in Nigeria that can still do that, they can produce. However, that is not coming immediately. It has to stay at least 10 years. Before you expect that to
No,
happen.
Chijioke, trust me, I wish we had more time. We would have discussed more. But then again, before I
he's
let
a
you
lecturer,
go,
right?
yes, now so that's why they like to give detailed
why the
explanation.
conversation is
It's
very
interesting.
strict. Yes.
So before
Thank
we
you.
let you go, finally, because of time, just give a word of advice to people who would want to receive this, like parents who will be worried. Tell them why they shouldn't be. Just in a few minutes, 2 minutes.
Okay. Yes. My message to the entire Nigerians, especially parents and guardians of these under 5 children, please, vaccine production is something that passed through a process that is not questionable. And for the world #1 body regulating health practice to sanction this, to say, yes, this is good for us to use, is not something that anybody should entertain fear about. Allow your wards, allow your kids to receive these vaccines. They are all for the good of all of us. And please, don't be afraid. Don't think that they have come up with another thing. As people, you will always think these things are maybe a machination to harm us in one way or the other. Please, remove that from your head. It is for your good.
Thank you very much.
Thank you so much,
very
Doctor.
much. So that's the much we can take on the interview and on New Day on Signature Television. Again, don't forget to go to all of our social media platforms. Go like, share, comment. We want to hear what you have to say. And of course, if you have questions for Dr. Chijioke, I know he prefers to be called Nurse Chijioke. So
Nurse Doctor.
Nurse Dr. Chijioke, of course. Yes, I know he likes that.
Or Nurse Chijioke Nwodoh, PhD.
No problem.
Right.
So if you have questions for him, don't forget, you can drop them on the comment section. We'll pass it across to him, and then he will get back to you. Before we go today is 2 of our staff's birthday in Signature Television.
Wow.
I just want to celebrate them.
Wonderful.
So, Queensley Roland was saying happy birthday to
Happy
you.
birthday,
Signature
Happy
TV.
birthday.
Saying happy birthday. And of course, Papa Collins, we are saying happy birthday as well to
The
you.
Emperor
Happy
is there.
birthday.
Happy birthday.
Signature TV loves you, and we celebrate today with you. We know it's a special day, so we're saying happy birthday to you. So, on New Day, my name is Joshua Oritogo.
And I'm still Chigi Chiagoro.
And this is me saying goodbye.